Your cat can't tell you when something's wrong. They hide pain. It's an instinct. In the wild, a sick cat is an easy target, so they pretend everything is fine. But there are signs, subtle changes that scream something is off. Today, we're breaking down 7 ways to know if your cat is sick. These are the signs most owners miss, and catching them early can save your cat's life. Let's get into it. Before we dive in, hit that subscribe button, because we're building a community of pet owners who want the best for their furry family. Now let's talk about why cats are so good at hiding illness. They're descended from solitary hunters. Showing weakness meant death. So what do? They mask every symptom until it's too late. That's why you have to be a detective. And the first clue? Number 1. Changes in appetite. Is your cat eating less or more? Both can be red flags. Why would eating more be a problem? Hyperthyroidism. It's incredibly common in older cats. Their metabolism goes into overdrive. They eat constantly but lose weight. It's exhausting for their body. On the flip side, eating less is more obvious. But what does less look like? Leaving food in the bowl, walking away from meals, or only licking the gravy and leaving the solids. Dental pain is a common culprit. Broken teeth or gum disease. Eating becomes painful. A vet can fix that in one visit. But here's what most people miss. Sudden pickiness. Your cat used to love their food. Now they sniff it and walk away. What does that mean? Nausea, or a change in their sense of smell. Cats rely heavily on smell to eat. If they can't smell, they won't eat. Upper respiratory infections are a common cause, and they're treatable. So what do? Monitor their bowl, measure their food, know what normal looks like. If they miss 2 meals in a row, call the vet. Don't wait. That was number 1. Number 2? This one is easy to spot. Number 2. Changes in water intake. Is your cat drinking more than usual? Or less? Both are dangerous. Why is more water a problem? Kidney disease. It's one of the leading causes of death in older cats. Their kidneys lose the ability to concentrate urine, so they drink more to flush out waste. But the kidneys keep failing. It's a vicious cycle. What about drinking less? Dehydration. Cats are designed to get moisture from their food. If they eat dry kibble, they need extra water. How much is normal? About 1 cup per 10 pounds of body weight. But that's a rough estimate. The real sign is change. If your cat suddenly empties the bowl, that's a warning. Or if the water level stays the same for days. Both deserve a vet visit. Here's a trick. Check their water bowl daily. Fill it to the same level. And see how much they drink. It takes 30 seconds, and it could save their life. One more thing. If your cat is drinking more, check the litter box. More drinking means more peeing, and more peeing means more trips. If they're having accidents outside the box, that's a red flag. They couldn't hold it. That's a sign of kidney issues or diabetes. And it's treatable. If your cat is showing these signs, drop a comment. Tell me what's changed. Let's keep going. Number 3. Changes in litter box habits. Is your cat peeing more? Or less? Or maybe they're straining, crying in the box. What does straining mean? A blockage, especially in male cats. Urinary blockages are life-threatening. They can't pee. Their bladder fills up. Toxins build up in their blood. It's a medical emergency. Vet immediately. What about peeing outside the box? That's not misbehavior. It's a cry for help. Why would a cat pee outside the box? Pain. They associate the box with pain, so they avoid it and pee on the rug instead. Bladder infections, crystals, and stones. All treatable with the right care. And what about diarrhea? That's another red flag. Parasites, bacterial infections, or dietary changes. But chronic diarrhea is serious. Weight loss, dehydration, and malnutrition. Your vet can help. Here's what to look for. Check the litter box daily. Look for color changes, blood in the urine or stool, or mucus. All signs of trouble. Also check the volume. Big clumps mean more peeing. Small, hard clumps mean less. What's normal for your cat? You should know. That's your baseline. Anything different is a warning. One more thing. If your cat isn't pooping for 2 days, call the vet. Constipation is serious. It can lead to obstipation. That's when stool gets so hard they can't pass it. It's painful and dangerous. Get it checked. Number 4. This one is subtle. Number 4. Changes in activity level. Is your cat sleeping more than usual? Cats sleep a lot, up to 16 hours a day. So how do you know if it's too much? Look at the pattern. If they're sleeping in a different spot or hiding, that's a warning. Why do they hide? Instinct. Sick animals hide to protect themselves. They feel vulnerable, so they find a quiet corner and stay there. What about the opposite? Restlessness, pacing, panting, inability to get comfortable? That can mean pain. Arthritic cats often pace. They can't find a comfortable position. Pain medication helps and improves their quality of life. Another thing to watch. Changes in play. Does your cat still chase toys? Or do they just watch? Lack of interest is a red flag. Why would they stop playing? Pain or illness. Cats hide pain well, so a sudden disinterest in play is big. It's a sign something is wrong, even if they look okay. And what about overactivity? Hyperthyroidism. They get restless, vocal, anxious. They might even wake you up at night. That's not just being a cat. It's treatable. So what do you do? Know your cat's baseline. What's normal for them? Then watch for changes. And don't dismiss them. Your cat is counting on you. If you're finding this helpful, please like this video. It helps more cat owners spot the signs. Number 5. Changes in grooming. Is your cat grooming less? Or more? Both are red flags. Why would grooming less be a problem? Pain or illness. It hurts to reach certain spots. Arthritic cats can't groom their backs, so their coat becomes matted and dull. It's uncomfortable and unhygienic. Regular brushing helps, but the underlying pain needs treatment. What about over-grooming? That's different. Cats who groom excessively are often stressed or in pain. They focus on one spot, like their belly or legs. They'll lick until the fur is gone, and the skin is raw. It's a sign of anxiety or discomfort. Allergy is another common cause. A vet can identify the trigger. And what about changes in the coat itself? A dull, dry coat, nutritional deficiencies, or underlying disease. What diseases affect the coat? Kidney disease, diabetes, and hyperthyroidism all affect the skin and fur. So a healthy coat starts with a healthy body. High-quality food helps, but if the coat is poor, something is wrong. One more thing. Fur loss, patchy fur, scabs. What causes that? Fleas, or mites, fungal infections, or even autoimmune diseases. All treatable, but they won't go away on their own. So check your cat's fur. Run your hand over them. Feel for mats. Look for bald spots. And check for dandruff. Dandruff can be a sign of poor nutrition or skin issues. Your cat shouldn't have flaky skin. If they do, see a vet. Number 6. This one affects breathing. Number 6. Changes in breathing. Is your cat breathing faster or slower? Or maybe they're breathing with their mouth open. That's always an emergency. Why is mouth breathing so serious? Cats are obligate nose breathers. They're not designed to breathe through their mouths. So when they do, something is very wrong. It's a sign of severe respiratory distress, heart failure, or asthma. Both are life-threatening. Immediate vet care. What about coughing or wheezing? Cats cough differently than humans. They crouch down and extend their necks, like they're trying to bring something up. What does that mean? Asthma, or heart disease, or a hairball. But it's not always a hairball. If they're coughing more than once a week, see a vet. It's treatable. Another thing to watch: labored breathing. Their sides heave. Their belly moves a lot. Their nostrils flare. They look uncomfortable. That's called respiratory distress, and it's a medical emergency. But what's normal? Cats breathe quietly. At rest, they take 20 to 30 breaths per minute. You can count them. How? Watch their chest rise and fall. One rise is one breath. If it's over 30, call the vet. And what about blue gums? That's a sign of oxygen deprivation. It's critical. They're not getting enough air. This is a life or death situation. Immediate emergency vet. Don't wait. If you're seeing any of these signs, don't ignore them. Your cat can't tell you what's wrong, but you can. Number 7. Changes in behavior and vocalization. Is your cat more irritable than usual? Or clingy? Both are red flags. Why would a sick cat get aggressive? Pain. They lash out to protect themselves. It's instinctual. A hurt animal is a defensive animal, even with their favorite person. So if your sweet cat suddenly hisses, something's wrong, and it's not about you. What about the opposite? Clinginess. Some cats seek comfort when sick. They follow you everywhere. They cry when you leave. It's anxiety. Why would illness cause anxiety? They feel vulnerable, so they seek safety from you. That's a sign to pay attention. And what about excessive vocalization? Yowling at night? Cats with hyperthyroidism do this. Or cats in pain. Why at night? They're alone and scared. It's a cry for help, or a sign of cognitive decline, which is treatable. Another thing to watch: hiding. Sick cats retreat. They find quiet spaces, closets, under beds, behind furniture, and they don't come out. That's not normal. It's a sign something is terribly wrong. And what about changes in their routine? Not greeting you at the door, not using the cat tree, not interacting with the family. That's depression. Why would cats get depressed? Illness or pain? They're not being dramatic. They're telling you something. So what do? Trust your gut. You know your cat best. If something feels off, it is. Don't second-guess yourself. Go to the vet. If you've made it this far, you love your cat. Drop a comment with the sign you're most worried about. Is it the appetite, the litter box, or the breathing? I read every single comment, and I want to support you. Now let's put it all together. 7 signs. Changes in appetite, changes in drinking, changes in litter box habits, changes in activity, changes in grooming, changes in breathing, and changes in behavior. Why so many? Because cats are complex, and they hide illness well. So you have to be vigilant. It's not about being paranoid. It's about being prepared. Here's the most important thing. You know your cat better than anyone. If something feels off, trust that feeling. Even if the vet says they're fine, get a second opinion. You're not being dramatic. You're being a good cat parent, and your cat is counting on you. What about annual checkups? Those are essential. Annual checkups catch things early. Blood work, physical exams, dental cleaning, all preventative, and all covered by good pet insurance. What about senior cats? They need twice-yearly checkups. They age faster than us. 1 cat year is about 4 human years. So what does that mean? Their health can change quickly. 6 months is a long time for a senior cat. So check them more often. One final thought. Don't wait. If you see any sign, call the vet. Early intervention saves lives and saves you heartbreak. So pick up the phone. Your cat will thank you. You deserve to have a happy, healthy cat, and it starts with noticing the signs, then taking action. If you want to go deeper, check out the video about cat nutrition. It works perfectly with what we talked about today. These aren't complicated concepts. They're simple. And they work. You just have to start. Make sure you're subscribed so you don't miss the next one. We're building a community of informed, caring cat owners. See you in the next video.